Tumors, blood cell origin. Mesenchyme is the embryologic tissue that gives rise to connective tissue, muscle, bone, and blood. When tumors come from blood cell lineages, white cells, red cells, lymphocytes, they are called leukemia, malignant cancer of blood-forming tissues primarily affecting bone marrow and blood. Cells circulate in the blood. Lymphoma, malignant cancer of lymphoid tissue, forming solid masses in lymph nodes or extranodal sites. USMLE style question. Question: a 12-year-old boy presents with fatigue, bruising, and frequent infections. Lab studies show anemia, thrombocytopenia, and a white blood cell count of 120,000 per microliter. Peripheral smear reveals immature blast cells. What is the most likely diagnosis? A. Lymphoma, B. Leukemia, C. Sarcoma, D. Myeloma, E. Adenocarcinoma. Correct answer, B. Leukemia. Explanation: this child presents with bone marrow failure signs, low red platelets, immune cells, and circulating blasts, which is classic for leukemia, a malignancy of hematopoietic blood-forming cells. Why not the others? A. Lymphoma involves solid masses in lymph nodes, not high circulating blasts. C. Sarcoma, malignant mesenchymal tumor, e.g. muscle bone, not blood. D. Myeloma, cancer of plasma cells, usually in older adults, and does not typically present with blasts. E. Adenocarcinoma, epithelial tumor, not hematologic. Question: a 25-year-old man presents with painless swelling in his neck. He reports intermittent fevers, night sweats, and unintentional weight loss over the past 2 months. Physical exam reveals a firm, non-tender cervical lymph node. A biopsy of the node shows Reed-Sternberg cells. What is the most likely diagnosis? A. Acute lymphoblastic leukemia. B. Hodgkin lymphoma. C. Non-Hodgkin lymphoma. D. Chronic lymphocytic leukemia. E. Metastatic adenocarcinoma. Correct answer, B. Hodgkin lymphoma. Explanation: the presence of Reed-Sternberg cells, large abnormal B cells with owl-line nuclei, and B symptoms, fever, night sweats, weight loss, strongly point to Hodgkin lymphoma. It often presents in young adults with painless lymphadenopathy, typically in the neck or mediastinum. Why not the others? A. Acute lymphoblastic leukemia usually presents with bone marrow failure, anemia, bleeding, infections, and circulating blasts, not isolated lymph node masses. C. Non-Hodgkin lymphoma can look similar but lacks Reed-Sternberg cells, often involves multiple nodes and extranodal sites. D. Chronic lymphocytic leukemia, more common in older adults, shows lymphocytosis in blood, not large lymph node mass in young adults. E. Metastatic adenocarcinoma would show epithelial tumor markers and no Reed-Sternberg cells.